I'll tell you when to start.
I can start?
No, just a minute. I'll mute myself because of the speaker.
Okay.
Hi, Christine.
Hi.
Thank you so much. Thank you so much for joining us, and we really appreciate you wanting to. Okay, just give me a second. Thank you so. Okay. So thank you so much for joining us, and in short notice, I know you're running around with all this. So I've been getting a lot of questions in regards to COVID-19 and what needs to be done, especially in children. You know, there's this rumor, or I don't know if it's factual, that children don't get COVID-19. So I want you to tell us from the perspective of a doctor, and especially the infectious disease expert, what's your take about this?
So good morning. My name is Dr. Christine, and I'm a pediatric infectious disease specialist. So I would like us to spend a few minutes just enlightening ourselves on what is all this corona, should we be worried, and what to do about it. Because there are all these stories going around, and some of them are just scary, and others are not true. So let us start by asking, what is corona? So corona is actually a group of viruses called coronaviruses. There are 7 known types of coronaviruses. So corona is not something that came just the other day. We have had these viruses with us, both in animals and in human beings. But let us focus on the ones in the human beings. So the first 4 corona types are the ones that cause common colds, the running nose, a little bit of cough, a little bit of fever, which each one of us will suffer from time to time. Then I want to talk about the other 3 coronaviruses, which have been discovered in the last 2 decades. So in the year 2002, we had an outbreak called SARS, which caused severe symptoms, severe acute respiratory illness. That is a severe type of pneumonia. And that came and went. Then in 2012, we had something called MERS, which was also corona. And that also caused severe pneumonia-like symptoms, and that went. Now in 2019, late 2019, and the early part of this year, you have been hearing of COVID-19. And that is the 7th type of coronavirus that has recently crossed from animals to humans and is responsible for the pandemic that we are now witnessing. So I have used a big word there. I have used the word pandemic. What is a pandemic? A pandemic is when you have a disease, an infectious disease that crosses from one country, crosses through another country, crosses a continent, and eventually goes to multiple continents in the world. That is a pandemic. So what we have now is the COVID-19 pandemic. So I know many people are very worried because we are all being glued to our screens, seeing how people are sick in Italy, in America, all those countries that you think are very, very big. They have all been affected by coronavirus. And we are asking ourselves, what is coming to us? What we have noticed since we began testing is that as of now, Kenya still has less than 100 cases. That is the ones that are tested. But what I want to tell us is that the symptoms of corona are not just the pneumonia. There are people who have coronavirus and they don't show any symptoms at all. And who are these people? mostly the children. So many people are thinking because children are not coughing, they are not, or maybe they are just having mild common cold, which they normally have, they cannot have corona. But in children, the ones who have been tested in other countries, some of them are testing positive without symptoms. And that may account for why we are not seeing a huge rise of respiratory illness here in Kenya, because, hi, you can listen. We are talking about the children and coronavirus. So you're welcome to listen. Hi, you can listen because mommy is working, okay? Yeah, and don't make noise. Good. So that is one of the people I'm talking about. There's a child who came on screen, and you know the children are very worried about this corona because they are seeing the parents behaving funnily. Everybody suddenly is wearing a mask. Everybody is washing their hands. Everybody is worried. And children, you know, process information differently because children have not matured enough to be able to process this kind of hard information. So we need to be careful to reassure them that everything is going to be okay. Now, back to COVID-19. What are the signs and symptoms of coronavirus? One, we can have those we call asymptomatic, meaning they have no symptoms at all, but they have the coronavirus in them. Then we can have those with mild symptoms, just a cough, a cold, a mild fever, and they don't feel extraordinarily sick. But the category we ought to be worried about are the ones who now get severe coronavirus. And what do I mean by severe coronavirus? When you get your lungs starting to get infected, you start feeling that you have difficulty breathing, shortness of breath, and very high fevers, very lethargic. These are the people we need to focus on. And these are actually the people that we are concerned about because they are the ones who will need high dependency care, ICU care. But the rest can just manage their symptoms at home. They will not die. Just drink the water, the concoctions that you people are famous for, the ginger, the garlic, take a little bit of paracetamol, antihistamines like Piriton or cetirizine if you feel they will help you with your symptoms. Use some nose drops if you're feeling congested, and please just stay home and stop panicking. If you're lucky enough to have your doctor's number, you can call them and ask them, should I come in? Remember, the tests are not widely available. And if they are, we are first as a country prioritizing on those who will need a lot of care, those with severe symptoms. So those are the ones we will focus on testing. The rest of us, let us just follow the guidelines. As of now, it is no longer relevant whether you came into contact with somebody from a high-risk country. Every country now is high risk. So our goal is act as though you are infected. So protect the other person. And what do? Stay home. Children, stay home. Stay home. Don't go randering that now is the time we can go to the mall. If a child is going out of the compound, it is because maybe they are sick and they are being taken to hospital. So children, stay home. Now, adults, also stay home unless you have to go buy food or you are sick enough to go to hospital or take your child to hospital. So one thing, let us stay home. Number two, if we have to go out, either to buy food or even to buy some medicine, distancing. Even the children, if possible, social distancing. What is the next thing? Hand hygiene. We don't say hand sanitizing. We only need sanitizers if you're going out and you know where you're going, you don't have soap and water. So maybe in the car, you can have a sanitizer. Maybe in your bag, you can have a sanitizer. But when you're home or in a place with soap and water, make use of that soap and water. It is good enough. So hand hygiene. Now, where does coronavirus virus make its entry. How do people get infected? You get infected by breathing in secretions from somebody who has coughed, sneezed, or talked very loudly, spitting saliva all over the place, and you breathe in those secretions. So that is one way. What is the other way? When these secretions from somebody who coughed and did not cover their cough or sneeze, and I will show you in a bit how you cover your cough and sneeze. If they coughed and sneezed and they did not cover their cough and it landed on a surface, say for example, it landed on a table, it landed on a chair, it landed on a light switch, it landed on a door handle, and you came and opened the door, switched on the light, you came, sat down, began working on your computer, which someone had sneezed on, then you touch that and you don't wash your hands or sanitize. Then you touch your face, and not just any part of your face. There are parts of the face that we call mucous membranes. Those are the linings of our eyes, our nostrils, and our mouths. Those are the portals of entry of the virus. And of course, not just the virus, but many other viruses. That's how they make their way. So what should we do about this? Please let us avoid touching our faces. Maybe the best thing might be, but this is on a very light note. Maybe put some pili-pili on your hands. When you touch your eyes once, you will not repeat it again. But that said, let us avoid touching our faces. If you have to touch your face, wash your hands first. Maybe you have to remove a contact lens or remove an eyelash from your eyes, or this itch that you must scratch. Wash your hands first. Wash your hands anytime you remember. Better just wash your hands. When you come from outside, wash your hands. For us people who work in high-risk areas, you can see I'm wearing scrubs. I have removed the mask because I am all alone in the room, and I have removed my head covering. I am wearing some special clothes, protective clothes called scrubs, which health hospital workers wear, so that when you go home, you remove them and wear your normal clothes, because these droplets can land on anywhere, including my hair. Because I don't wash my hair every day, I have to wear some kind of cap when I'm in the hospital. Now, there is a question that I know many parents are wondering. Should our children go out to play, or should we lock them up in the house? I have children as well. I don't have answers. There is no study that has come out yet. People are very busy trying to look for cures. Nobody has really thought that now we can look at the children whether they should go and play. So let us just make our own guidelines right here and say that try as much as possible to keep your children indoors. Engage them in activities indoors. They can do housework, they can do their homework, they can play with their dolls. Now, if the children have to go out, I hope it is in a situation where you are considering your neighbor is your family. They are also practicing maybe this hand hygiene and they are not infected. But if you are not able to ascertain that, I will leave this to the judgment of the parents. You decide for yourself whether you want your children to go out or to stay in. Remember, children cannot social distance. I don't think so. Mine can't, and they are not that young, but I don't think they can. So just think about that and discuss amongst yourselves in your community how you're going to do this. The other thing that I will tackle is that let us be positive. You know, our children are listening to us and they are seeing all the tension. And they are sometimes hearing people saying, oh, children are the ones spreading this thing. So let's be careful how we talk. Let us have a routine. You know, children thrive on routines. So let them wake up in the morning, take their breakfast, do some household chores, make their beds, have some kind of order in the house. Even you parents, please, wake up and shower. Don't walk around the whole day in pajamas. No, you'll feel unwell. I mean, the children need some order. Let there be meal times, healthy meals. Let them also stretch their legs, do some kind of exercise, even if it is indoors. And if they have to go out, you will work out your own method of how you will protect them. Now, this is not part of us, but I will tackle it. There are those among us who are expectant, pregnant mothers, and they are wishing they were not pregnant. Don't worry about it. There is no confirmed case of a newborn who got infected from the mother through pregnancy. That few cases of newborns with COVID-19 got it after birth from exposure, maybe to the mom who was already COVID infected. And the newborns, surprisingly, did not get severe disease. They are well and they are thriving. The one infant who got very severe disease had other issues. It was not related to COVID. So pregnant mothers, don't worry. Breastfeeding mothers, breastfeed your infant, but take precautions. You know, at some point, all of us will be COVID infected, breastfeeding or not. But we are in a low income country. Breast milk still remains the safest form of nutrition for babies under 6 months. So please breastfeed your babies. If you have to use a mask, so be it, but breastfeed. Now, I come to the question of masks. Are we supposed to wear masks or not? Now, about this COVID-19, guidelines are changing by the day because this is a new disease to everybody in the world. There is nobody who has an upper hand. So currently, the guidelines are saying that you should have some form of protection, some form of facial covering. We are no longer talking masks. We are talking facial covering. So if it is possible and you have to go out, try and wear either a cloth mask. You can cover your nostrils and mouth even with a scarf. It is not to protect yourself, but it is to protect others from your secretions. Why do I say this? Have you seen how people are acting on the ferry? How can you social distance on a ferry? Have you seen how people are acting on the public transport? People still have to go to work. You cannot start telling people to stay home. So we have to find a way of protecting ourselves. So guidelines will now, and I'm not preempting anything that the Ministry of Health will say, but if you have to go out, it would be good that you have some form of facial covering. It doesn't have to be a high-level surgical mask or an N95 mask. Please leave those for healthcare workers, but a cloth covering, homemade, is good enough to protect transmission from yourself to others. And last, as I go,
Dr. Christine, we've lost you.
yeah,
Go on.
I can, let me go on. Okay, so lastly, I'll just tell us, let us stop taking ourselves and our children up country. Stay in Nairobi. We are already in a high transmission area in Nairobi. And we have our elderly parents up country. Let us keep ourselves in Nairobi and not take the infection up country.
Thank you so much, Dr. Christine. One thing that
we know that.
Hello, Dr. Christine.
Sorry, let me go on. Now, my other point is, I had written it somewhere, so I'm trying to look whether I have missed anything. Yes, rumor mongering. Please let us stop forwarding conspiracy theories, scaremongering. By the way, our children are reading these things and they are hearing them. Let us stop forwarding about this and that cure, this and that conspiracy theory. Let us be positive. Leave the information to the healthcare workers. Listening to the CS when he comes to give updates. Listening to recognize health professionals, people from World Health Organization and other global bodies. And stop fearing. We shall overcome. Thank you.
Thank you so much. I know you don't have time, you're running to treat and to do the good job you guys are doing. But I'm going to raise two concerns. One of the concerns that I've had over and over is an issue of what do we do prevention apart from cleaning and hygiene and sanitizing, which I think we have done until our hands are sore. What else? Because I had like taking vitamins. Like I went to the hospital the other day to a pharmacist the other day to buy multivitamins, and they had run out because people are buying multivitamins. What else can we do to ensure that our children's immune system is stronger so they don't get COVID? Even if you're thinking all of us are going to get, just to reduce the illness and the symptoms, what else can we do from a doctor's perspective so that we don't do all the conclusions we are doing?
Okay. Let me just add one aspect I had actually forgotten to add about prevention. Clean the frequently used surfaces, clean the light switches, clean the tables, clean frequently, especially for those of us in offices. Maybe home may not apply so much, but if you're coming and going from home to out, clean the frequently touched surfaces. Even you don't have to use bleach. You can just clean them even with soap and water. Just clean the frequently used surfaces. Now, for boosting your immunity, that is neither here nor there. Let us just eat a balanced diet. You don't have to go buying multivitamins, but eat your fruits, eat your vegetables, eat a balanced diet. Unless you have any deficiencies that have been proven, maybe iron deficiency that the doctor told you have iron deficiency, take an iron supplement. If you have vitamin D deficiency that has been proven, take a vitamin D supplement. Otherwise, the rest of us, just eat sensibly, eat a normal diet, and keep yourself well hydrated. But don't overdrink the water. Just be sensible, and don't go buying expensive supplements. And don't go buying the things that you've heard are cures. You go and stock up on them. We might cause a shortage of essential supplies by hoarding. So don't read something on the internet, say this is a cure, and go and stock up on it. Okay? Yeah.
One last question. So if you've been told, like I've got a thing in Italy, America, and the UK is people have been told to have COVID. So what are some of the things that you can take to manage the symptoms at home instead of going to the hospital and overburdening the healthcare workers?
Okay, so don't come to hospital if you have just a common cold, even for your child. If they just have a common cold, please keep them home. Why am I saying this? Because when they come to the hospital, it could be COVID, that they have COVID-19, and they just come in to expose the healthcare workers. Keep them home. Just manage the symptoms the way you normally manage a common cold. There is nothing special. Your only reason to be coming to hospital is if you have a high fever that you cannot manage, breathing difficulties that you feel are getting out of hand. And I'm talking about your children now. But if it's just a cough and a cold, and maybe just a mild fever, please stay home. Only come if you're sick enough, needing to go to the ward, or perhaps needing an antibiotic. But don't come early, because what I'm seeing parents doing, they're coming early because the child started coughing last night. I want to come early before this thing becomes serious. But that's not the way, because you bring your child here. I'm telling you this, right now I'm in the clinic. Children are just touching everything everywhere. They cannot social distance, so they will pick the COVID from here. So keep them home. Yeah, just keep them home. And if you have to bring them to hospital, don't bring the whole family to hospital. Just one caregiver, one child. Thank you. And I have to go now.
I know.
Yes.
Thank you so much. I know you don't have time and you only had 30 minutes and it's a very short. Thank you so much. This video is going to be available on YouTube. So for anybody, just post your question in the comment sections. I'll sure send them to Dr. Christine and we see how we are going to respond to them. Probably can do another Q&A later when she has some time because she's very busy. She had only 30 minutes this morning. So thank you so much for those ones who are watching. And thank you so much, Dr. Christine. Thank you so much. See you next time. Thank you.
Thank you,
Okay,
Jenny.
bye.
Nice talking to you. Bye.
Bye.